is so great to see the turnout. My name is Tiffany Hang Moss, and I serve as Dean for the College of Agricultural Sciences and Natural Resources here at the University of Nebraska-Lincoln. And it's my distinct pleasure to welcome you on behalf of the Institute of Agriculture and Natural Resources to today's Heuermann Lecture. For attendees of the Water for Food Global Conference, it is good to see you again, and I hope that you have enjoyed the various sessions today. The Heuermann Lecture Series is made possible by a generous endowment from Keith and Norma Heuermann. This lecture series has served as a powerful platform for engaging in dialogue around critical issues such as food security, natural resources stewardship, the intersection of health and agriculture, as well as the sustainability and vitality of our rural communities across Nebraska and around the globe. Sadly, we lost Keith last month at the age of 99. I had the honor of visiting Keith in March, just weeks before his passing and just shy of what would have been his 100th birthday. And I will tell you that the session before this was on AI, and Keith was definitely up to speed at the age of 99 on the future of agriculture and how we were using AI and everything around digital agriculture. And so it was just a wonderful conversation. He was truly a leader and champion of Nebraska agriculture and a strong supporter of INR and the university. And so today we honor Keith's legacy with a video tribute.
Keith Heuermann embodied all of the characteristics that we know as Nebraskan characteristics. Kind, smart, innovative, curious, and humble, with an amazing work ethic, who took this new Nebraskan under his wing, and I'm forever appreciative.
Over his nearly 100 years of life, Keith Heuermann embodied everything that was great about Nebraska agriculture. He was obviously an innovator in the way that we produce seed for the crop industry. I remember him telling me this story about delivering oat seed to my wife's grandfather in the 1940s, all the way to being an innovator in the popcorn industry and an innovator in marketing through the QVC network in its early days for BK hybrids.
And they would sell, we packaged 24 packages in a case. They'd sell it by the case, and one time we usually had about 8-minute segments, 7 or 8-minute segments on air. One time they sold over 8,000 of those boxes in our segment. It was unreal. QVC, when they tell you they're selling a lot of stuff, it's true. They're not just telling you. What you see and hear there is true.
Keith's impact on Nebraska is far-reaching. His understanding of agriculture is just incredible. To think that he had 95 years of seeing how agriculture evolved from animal agriculture and mechanized agriculture to the role of hybrids, to artificial intelligence and everything in between. Keith's knowledge of corn breeding, his entrepreneurial spirit, has had an immeasurable impact on our corn production systems, whether that be corn for food, for fuel, or in the case of popcorn, for human consumption.
I was a Greenhorn Vice Chancellor of INR in 2010 when I first really got to know and met Keith and Norma Heuermann. And Keith had been so supportive of the Institute and of the university throughout a number of decades before that. But he wanted to do something big to support INR and the University of Nebraska-Lincoln. And as part of a gift he made, we designed the Heuermann Lecture Series, what's become, I think, one of the leading agricultural sciences seminars and ways for us to think about the challenges in agriculture in 2011, when we started what's now the Heuermann Lectures. And it was initially, in Keith's humble way, said, I really don't know if I want my name to be that prominent, but he came to love that lecture series even after the first few that he attended routinely up through the rest of his life.
Yeah, well, see, I thought these lecture series were really well done. We didn't have anything to do with selections, you know. But I thought they fit, partly they fit the awareness of what we're going to have to do in the future. You know, they talk about the 9 billion people that we're going to have by 2050. And those lectures really brought forth the awareness, I thought, better than anything else that I know of. As, look, we better start thinking, how are we going to do this? What's it going to take to get it done?
What a great tribute to Keith. And we do have some of Keith's family here with us today, so could you please stand so that we can express gratitude to your family? Thank you for all that you do to support Nebraska agriculture, the Institute, and the university. And now it is my distinct pleasure to introduce Dr. Jesse Bell, Director of Water, Climate, and Health with the Doherty Water for Food Global Institute. Jesse.
Thanks, Tiffany. Well, thank you for being here today. I really appreciate it. This is a great honor. And I'm looking forward to our discussion, our panel discussion afterwards as well. And so I'm going to be moderating the session tonight, and I get the honor of introducing our speaker, Claudia Ringler, Dr. Claudia Ringler. Claudia is the Director of Natural Resources and Resilience at the International Food Policy Research Institute, which she will be our keynote speaker. She is a thought leader in water for food. She has close to 30 years of experience in conducting research at the intersection of water, food, and ecosystem health. She has done work in Africa, Asia, and Latin America. In 2021, she was awarded honorary lifetime membership at the International Water Resources Association and the International Association for Agricultural Economics for her lifelong contributions to water, resources, and agricultural economics. And so with that, it is my honor to welcome Claudia up here to begin our discussion for tonight. So thank you, Claudia.
Yeah, thank you very much for the kind introduction. Okay, we'll put it. Yeah, thanks so much for the kind introduction. Also to the Institute for inviting me to give this lecture tonight. I think it's quite fitting for the topics that the Heuermann lecture is trying to convey, which is natural resources, food security, and also forward-looking. And maybe two quick additional statements, given that this is a Heuermann lecture. So I looked up your father, relative, and I saw that he became famous first by deciding to do some private investment in hybrid seed technologies. And of course, I'm part of CGIR, and so we are the largest agriculture research network for a food secure future, focusing on low and middle income countries. And of course, most of what we started with is exactly that: breeding maize, wheat, and rice technologies. So I see a very strong connection here with the private and the public sector focus, but all the same, looking for the same goal, which is a more food secure future. And the second part that I liked that I saw is that he said, that people don't really understand what farmers have to deal with. And it's kind of, he seemed to describe it as a struggle. Every season it's another struggle, and there's someone and something that's trying to get your crop away from you. I think that's what he said. And it's either through climate or some insects or something else is trying to get these crops away from you, and you kind of fight back. and you obviously hope to be the winner. And I think what the Dougherty Water for Food Institute does is to make sure farmers are the winners through better water management and natural resources management. And my lecture today as well, focuses on that. So irrigation is there, irrigation is here to stay, irrigation is necessary for food security, but how can we make this win bigger? So how can we go beyond food security and also improving nutrition outcomes, given that we have a global food insecurity crisis, but we have an even larger nutrition crisis. So let's see how we can fight back to not only support food security, but also nutrition through irrigation and agriculture. And yeah, there I went already to the next slide, but I wanted to also just say that this work, of course, is not all done by me. A lot of this was supported by the US government through one of the Feed the Future Innovation Lab for small-scale irrigation that really didn't just look at irrigation, but also to see what more can we get from irrigation. What do we need to do differently to get more from irrigation, given that there's only so many water resources to go around. The work was started under Texas A&M University, but staff have also moved to the Dougherty Water for Food Institute, and it included both my institute, IFPRI, and the International Water Management Institute. And finally, I just recently put on an additional logo in the middle. It's the WASAG Working Group for Water and Nutrition. So that's a LinkedIn group for people who are interested to learn more and contribute more to the nutritional benefits from irrigation. And tomorrow there are some WASAG-related sessions for people who would like to learn more about this WASAG initiative. But now to actually get to the talk. So it's about nourishing the future through irrigation. So, I mean, this is nothing new for anyone in this room, but I just still wanted to put it down, because everything that's written here surely contributes to food security, right? We are expanding the growing season, we are improving the cropping index, we are diversifying the production mix, we improve, through irrigation, we improve the benefits of other inputs such as fertilizers or seed technologies. And we're, of course, through irrigation, at least in many low and middle income countries, we also providing water resources for domestic uses. And so water for domestic uses is also important for nutrition. And if we want to maximize the nutrition benefits from irrigation, we have to pay more attention to domestic water. And while this is focused in low and middle income countries, I understand it's also a big issue here. There's the well testing program happening by the Dougherty Center, and that's happening because of the interaction of irrigation and domestic water uses. And we need to make sure that if we irrigate for nutrition, our domestic sources also have to benefit nutrition. Those are interlinked systems. Anyway, so that's why we do irrigation. And obviously we have known, I think we have forever known that, if you do have water, you're more likely to have food security, you're more likely to have nutrition. That was also the statement by the speaker from Brazil a couple hours ago here in the same plenary, and indirectly it was also the message from our speaker from Sudan, who is the Nile, the lifeblood for so many countries in Africa. We did some work where we just asked people, what's your water security or what's your water insecurity status and what's your food insecurity status? And unsurprisingly, and this is various places in Africa, we found a very strong interlinkage. So nutritionists traditionally, focus on, what is on the table, maybe what are some health interventions, what are some childcare interventions. But nutritionists traditionally don't look at irrigation, but what we found is irrigation and water security at the household is very closely interlinked with the food security status and also the nutrition status through here, showing that if you're water insecure, the chance that you're actually consuming a healthy diet is much less because you're consuming fewer food groups. So it's definitely an interlinkage we have to, we have to work on. It exists, and how can we optimize the outcomes for both irrigation and nutrition? And that here is really the big question, I guess, that underlies the whole talk. Does irrigation support or hinder nutrition? You ask a farmer or you ask an irrigator, they will always say, oh, yeah, we support nutrition. But there are some, some positive pathways from irrigation to nutrition, but there are also some negative pathways. So when we started out this work, we tried to talk to some nutritionists in our partner countries. And for example, in Ethiopia, I visited the Ethiopian Public Health Institute. Their main goal is improving nutrition and health. And I said, what do you think about irrigation? Is it good or is it bad? And the Ethiopian, the gentleman I talked to, he says, no, we don't want irrigation. It's bad. It pollutes our water resources. It takes our drinking water away. We don't think irrigation is a good thing for us. And then I went to Tanzania, and I talked with the rural community health department, again, someone there, and I said, what do you think about irrigation? Is it good for community health? Is it good for nutrition? He's like, yes. I'm always sending my people to take some classes on irrigation, and we know that if there is irrigation, we have healthier and more, healthier and better fed children. So basically, you find both opinions out there. And then the question, and basically what it also tells us, it's probably not a straight line from irrigation to nutrition, but we can straighten the line if we are intentional about nutrition in our irrigation. And that is basically the main message of this talk. And here are just some other reasons of why some people are not very happy about irrigation. Once attended a so-called Safe Global Water Summit, and I thought I would be welcome talking about irrigation, but they're all like, no, those were mostly drinking water, water supply and sanitation people. They're like, no, you're taking our water away, you're polluting our water. They were not very happy. So there is real competition. So it's correct, there is competition between irrigation and other water uses, of course, also environmental uses. And the environment is also very important for our food security and nutrition, and of course the drinking water competition. There is a linkage between irrigation and pollution of water bodies, and again, that's very well known, even more so known in high-income countries in the United States. And then of course also water-based borne diseases. Malaria used to be extremely common here 100 years ago. It's still very common, in many low-income countries close to water bodies and sometimes close to irrigated areas. But again, it can be addressed. And then, of course, the question also is, what do we irrigate? Is this really good for our body? Is it actually, is it healthy? Other commodities, once we consume that, improving our nutrition or actually worsening our nutrition and contributing to non-communicable diseases? And in reality, if you look at the absolute global volume of blue or irrigation water, it is used for rice, it's used for wheat, sugarcane, corn, and cotton. Cotton, obviously not necessarily very good for nutrition. Sugarcane, basically bad for nutrition, and we unfortunately consume more and more of it. If we could, bring some more policies in to reduce sugarcane production and thus sugarcane irrigation, the world would be a healthier place for sure. And we could also save a lot of water resources. So that is basically the other question. If you just irrigate, let's say, sugar and cotton, corn obviously has many uses, and not all uses are used for nutrition, the biofuel uses. And so there are some people who are saying, how does all of that actually support nutrition? And definitely not all of it does. And the last part of the speech title is in a changing world. And obviously, there are so many changes. Changes are accelerating. It's, you do the slide and you can actually change it again because something else is happening. But we certainly have seen an acceleration of global crises that affect food security and nutrition. Biofuel policies is less so a crisis, but it certainly has affected food security and nutrition. It has, elevated prices of corn, with, that means some, low-income countries and then populations have, as a result, had increased food insecurity because they couldn't afford the more expensive commodities. The COVID-19 crisis has affected food supply chains, has led to more focus on self-sufficiency, which also, the attempt to develop more local irrigation, and that works in some countries, but in other countries it doesn't work. For example, Egypt said, we'll increase irrigated wheat by, 200,000 acres. but they actually absolutely do not have the water resources. They should rather, focus on trade. And then obviously the war in Ukraine is still very much affecting food security and nutrition globally. Overall, there is, as a result of these crises, we see more pressure to develop irrigation, but we also see fewer resources available for irrigation. So that means we see this growing inequity where some can and the rest cannot improve their food security through irrigation and other agriculture practices. At the same time, of course, we have, as everyone knows, growing constraints on water availability. There's droughts, floods, peak glacier melt. This is the UN year of glaciers or glacier melt to try to bring this to the global attention. The Western Hemisphere, the peak glacier melt is already, we have passed it. That means in the future there will be less meltwater coming down from glaciers to support our rivers and streams, and basically, again, which in turn would support irrigation. Another sign of challenges with water availability, of course, is groundwater depletion. Again, you can do a separate lecture just on that, but I think it's a pretty clear sign that we have to use our resources more carefully, and of course, heat stress events that then lead to increased irrigation water demand. So all in all, we are switching on the irrigation side from torrents to trickles. There's lots of opportunities to do better, and I think Nebraska and the various irrigation industries that are based here, that's their goal, right? To do more with less water. But still, if you look globally, if you go into farmers' fields, outside the centers of excellence, you will see that there's a very, very long way to go to improve water productivity. So we basically do need to improve water productivity for basic food security, but also for nutrition. So just some of the nutrition facts, and we have a discussant who knows more about nutrition and health than me, actually 2 or 3. But yeah, just some basic facts. So first, we've had this long-term decline since the 70s. So this thing starts in 2005, but we have had a long-term decline in the number of people who are hungry, like go to bed hungry. So they really wish they could have had another meal. That situation has changed more or less, between 2014 and 2017. Since then, it's going up, and while it's slowing, we haven't seen the number of undernourished, the population that suffers from hunger. We haven't seen the population going down again. Many reasons of why it's going up: changing weather, conflicts, the COVID-19 crisis. All of those have contributed to this increase in the number of food insecure people. Also, severe underinvestment in agriculture research and development. If you look at the numbers, they really look quite bad, with exceptions, basically 2 global exceptions, and those are China and Brazil. That's why their numbers, in terms of agriculture growth, look very good, and the rest of the world looks pretty bad, pretty pathetic. United States has been doing quite well, but we'll see where this is going. And there's a direct linkage between how much you invest in agriculture R&D and agriculture productivity, and also food insecurity. But of course, tempered also by extreme climate events, conflicts, and other crises that seem to multiply. So now that was still food security, not nutrition. Now we are moving into nutrition. So nutritionists, they live in their own world, and they have their own indicators, and they have their own frameworks, and you have to, if you want to work with them, you have to follow what they consider as acceptable. And so beyond the number of people that are hungry, we have this generic concept of malnutrition, and that includes various types of bad nutrition. And globally, 1 out of 3 people is affected by malnutrition. So malnutrition includes micronutrient deficiencies. That is, you don't have enough vitamin A, iron, zinc, whatever it is. And to get to these things, to get to these micronutrients, you either have to consume vegetables, fruits, animal source foods, or you have to enrich other commodities, iodine salt, or fortified milk, fortified with vitamin D, whatever. So a lot of these products are on the market, but in low and middle income countries, you don't get them. And of course, even in high income countries, there has been a return to higher levels of iodine deficiency, for example, which then can actually lead to challenges for mothers giving birth, also some cognitive deficiencies, etc. Because a lot of countries have slacked. They have said, oh, we are so well nourished, we don't really have to care about our micronutrients. But so there is a return even in high income countries to micronutrient deficiencies. And we can address those through irrigation, irrigated vegetables and fruits. But of course, you have to do more. You really have to do some education on what people should consume. Obviously, the other trend that is now very well known is overweight and obesity. And obviously, it's also on the increase, many factors. But of course, what we consume is a very big part of it. It's not the only part. There's also mobility, in terms of mobility and then jobs that people are taking on these days, not the farming jobs, the other jobs. And so again, it's a malnutrition situation that has to be addressed. But most important, I think, because really, not desired and not very difficult to influence is stunting. And so stunting is an outward sign of undernutrition in children below the age of 5, and usually when we measure children and then they are too short for their age, we cannot reverse it. So stunted children, the percentage is unfortunately really unacceptable at 22%, but it was 40% in 1990. So again, we've had some improvement, but we're not making further improvements right now because of the way we produce food, we share food, and we consume food. But stunting, what it basically is, it's an outward sign of reduced cognitive abilities, and children that are stunted are generally more likely to get sick, more likely to die early. They will not be able to be as productive as non-stunted children, and their cognitive abilities in school will always be lower. And we have a lot of countries in Africa and elsewhere, where 30–40% of children are stunted. And so then you kind of wonder, one generation later, why is the GDP in these countries not going up? It's not going up because they have never had the nutrition that they needed in the first 1,000 days, which is from conception until age 2. They didn't get the nutrients they needed, and it's impossible to catch up. To provide the nutrients later will unfortunately not turn the situation around, because their brain development has already been negatively affected. So there's a real reason to do better on nutrition, and mostly for the stunted children. Everything else also matters, but I think that's the number one thing we want to focus on. And an additional indicator to support nutrition and to better understand where we stand on nutrition and diet quality is a relatively new indicator that calculates the population that cannot afford a healthy diet. And the way this is calculated is if people have to spend more than 52% of their income on the lowest cost basket of what constitutes a healthy diet, so different food groups, if you have to spend more than 52% of your income on that, then you are simply not able to afford a healthy diet. And that gives us, a lot of information on where we need to focus, for example, our irrigation interventions on, and obviously also other nutrition interventions. So globally, we have 3 billion people that currently cannot afford a healthy diet, and that's about 42% of the global population. Unsurprisingly, most of that population, or the share of the population that cannot afford a healthy diet, is concentrated in sub-Saharan Africa, where 85% cannot afford a healthy diet. That's mostly fruits, vegetables, and animal source foods, so milk, dairy, milk is the same thing, other livestock products, but also eggs. So they just can't afford it, so they just eat the cereals, and obviously contributes to all kinds of deficiencies in their lives. Now, as I mentioned, if we want to bring irrigation and nutrition better together and to really improve nutrition outcomes through irrigation, we have to understand how nutritionists think, and what nutritionists think makes a difference for malnutrition, and actually here it says death as well. And there's basically two main factors. So one is, that you don't have an adequate diet. That means you don't have access to those 10 food groups. You might just eat cereals, bread and water. And you're sick a lot. And then, the question then is, why are you sick? And a big reason of that is that you don't have access to sanitation, you don't have access to water supply to wash your hands, you don't have access to safe drinking water. So that, again, brings together, why we have to work from the irrigation side and from the water side on both irrigation and the wash side together. We can't just focus on irrigation. We have to make sure whatever irrigation we do does not affect the wash side, the safely managed drinking water, etc. Because you can provide all the calories you want, but then if someone is sick all the time and has diarrhea every week, the calories will not stay and you will not be able to get good nutrition. And so irrigation basically has a role to play in all of those areas. So one is obviously providing a healthy diet through irrigated vegetables, fodder, whatever it is, but also maybe to make sure that there is no unsafe water environment around the household, so that you actually have access to some wash services. And if we can provide irrigation close to the homestead, and if that water, for example, can be used for domestic purposes, women don't have to travel, for half an hour or more to collect water 2-3 times a day, then we actually, maybe they have more time to take care of children, which is the third underlying factor of malnutrition and death that the nutritionists are using. It's a UNICEF 90-90 framework on causes of undernutrition. So whatever we do on irrigation, and also of course on wash, we need to make sure that women's time burden is reduced and not increased. So we don't want manual irrigation, we want motorized irrigation. We need to save time so that the third factor affecting stunting of children is also addressed, and that is women's time to take care of the sick and also of children. And of course, I'm now saying women because this is still the norm and the tradition in much of the low and middle income countries, but men obviously are also called to participate in those tasks. This is just the way most of the data that we collect, we find that women are still responsible for childcare. So now, based on all of this formative work, we developed 4 positive pathways from irrigation to nutrition. So if we want more than food security, we want to really affect child nutrition and also maternal nutrition. And so one is the agricultural production pathway. So we just produce more, and obviously we produce in the lean season when food prices are much higher through irrigation. We can also increase household income. So yes, you can still grow coffee or sugarcane, even so that it's very hard to see a positive linkage to nutrition. Let's say coffee or dark chocolate, cocoa. You can generate income. You don't generate food that you put on a table, but you generate income. You use that income to improve health of the children, or to buy the food, the vegetables that you don't grow yourself. And then, if irrigation is done intentionally for nutrition, you should also make sure that at a minimum it doesn't reduce access to water supply and hygiene. Ideally, you actually at the same time improve access to water supply. And finally, women's empowerment, that's always a challenging pathway. Can you actually, through irrigation, empower women to potentially own the technology, or at least have access to the profit from the irrigated produce? So there's various ways to do it, but it's certainly not a very straight line at all. But as you've heard, women are definitely at the center of child undernutrition, so we have to support them if you're serious of reducing childhood stunting. And so those are the 3 pathways, just shown in a different way, and some of the activities that can be done if we want to make sure that irrigation actually improves nutrition. So for example, on the women's empowerment side, decrease the burden of water collection, because that still takes a lot of time in parts of Africa for women. Yeah, and then, for example, if a project goes in, can you ensure gender equitable benefits? Generally, men more likely own the land where the irrigation technology might be deployed. So what measures can you take, to ensure that there are benefits for women, and for example, through them helping to decide what's being grown on the land, even if they don't own it, etc. So there's some measures that can be taken. And now, obviously, quite a bit of evidence has been generated for those pathways. So the very clearly higher yields, we don't have to talk about that. You irrigate, you don't irrigate. Most cases, obviously it's not 100%, but in most cases you get higher yields with irrigation. You don't get higher yields if you have absolutely no fertilizer and you didn't need to irrigate. There's obviously research that has shown the very strong potential benefit from irrigation on the production pathway because of the lean season, that means the dry season. And then in terms of crop diversity, it kind of depends. So you have to be intentional. So if you're in a food insecure location, and in terms of production, sometimes like in Bangladesh, when they started with irrigating in a dry season, it was all rice. So everyone was just growing rice, and so that doesn't actually increase your crop diversity. So they're now trying to steer towards more crop diversity. But often, especially small-scale irrigation, we do find more vegetables and fruits. Income pathway, yeah, again, it's quite, a lot of research that if you're an irrigator, you simply have more disposable income and you can use it, for example, during a drought event to retain your expenditures for foods, etc. And also employment is increased. This is just, some research that does show also, quite clearly that household dietary diversity improves for irrigators compared to non-irrigators in Ethiopia. And many other pieces of research. And I guess the most important one is, in Ethiopia, we found for irrigators that their children had a lower likelihood of wasting, which is not the same as stunting, but wasting is another intermediary or important nutrition indicator. So we can really definitively show that you can positively affect nutrition through small-scale irrigation. On the wash pathway, it's mixed, because obviously most irrigation projects don't care if there is water at the household. It's just not something they're thinking about. We did find that if the irrigation water source is groundwater, and if it's close to the households, then it's, then there is a possibility that you do have more water for domestic purposes. That's also clean. Obviously, if you take surface water for irrigation, take the same surface water for domestic uses, you don't necessarily have a safe drinking water source. But there is a growing number of evidence that's being generated. On evidence of women, the women's empowerment pathway is also mixed, and one has to be very intentional if we really want to improve women's empowerment at the same time that we're putting small-scale irrigation in, and through that pathway improve nutrition. Unsurprisingly, women may be less likely to adopt irrigation given lack of access of lands, other constraints, no access to credit, etc. Again, outcomes depend very much on the technology, the irrigation technology, and intervention design, and on the overall context. And there's some studies, but I think I don't have a lot of time left to discuss them. I see some red screen in front of me here. But we are finalizing one study where we could show that if you use motorized pumps in those households, women actually spend less time in the field, and they do have more time for leisure, which is also important, and obviously alternatively for childcare. But again, if you want to be intentional to increase women's empowerment and nutrition that way, you have to plan things very carefully. Don't come in with your system and think it's going to happen automatically. So what are some entry points for improved nutrition outcomes? Here is like 8 different entry points. For sure, if you're thinking about irrigation, and you might sell irrigation technology, you probably don't think about nutrition, but you might want to. And if you want to, what would you do differently if you don't just want more profitability, but you actually want more nutrition? So you can work with a community platform and say, there will be much more irrigation going on here. So we don't know what the farmers will actually grow, but maybe you can work, community health workers, or with other community organizations, you can work with the farmers to let them know what kind of vegetables are out here, what kind of seeds, what can be sold in the market, or what is actually good for human nutrition. So really work with health workers and other agents to bring these interventions in at the same time as you see more irrigation happening. And of course, engaging women in irrigation interventions, because they are usually the ones who have to put the food on the table. They're not necessarily generating all the income, but they still have to cook the meal. So if they, if they have a choice of what could be grown, very often they will come up with something more, a diversified cropping pattern than maybe the husband would. And then there's also indicators that have been developed that, again, everyone who would like to be more intentional about nutrition through irrigation can use. So there's, for the production and income pathway, those are a bunch of indicators. And those are indicators you would develop at the design stage, and of course you wouldn't use all of them. But the key is you actually would want to monitor them after the irrigation has been deployed. And then if things go in the wrong direction, like everyone is growing monoculture, nutrition might actually go down, women's time burden might actually be larger, then it's a good time to go back and see, maybe you should do something different if you want to be intentional for nutrition, or you say, we don't care, there's some income generated, and hopefully, we'll still get some nutrition out of it. So there's also some indicators for the wash pathway. For example, if the irrigation system is in, do women spend less time collecting water or more? If they spend more, is it because now their domestic well doesn't yield any more water because all of the water was sucked up by the irrigation? So those are some important things to look at. For the women's empowerment pathway, again, is any irrigation technology owned by women as a result of this activity? Are there any water institutions where they could have a role in the say, etc.? And then, of course, it's not a straight line because there are harmful pathways, and that's what I started out with. And those also have to be addressed if you're serious about nutrition, positive nutrition outcomes. So one is, for example, also put in some extension on fertilizer and agrochemical use. Also train on irrigation scheduling, not just selling a technology. There's watershed protection. There is health extension on water-based and waterborne diseases. There's a lot of health workers going to the villages, and then you have the agriculture extension worker going to the villages. They could go together and actually really make a difference for nutrition. It's not generally done, but it can be done. My last slide, just to summarize, I very strongly feel that irrigation is essential for better diets and nutrition, but of course it's not a panacea, right? Everything else has to also fall in place. You have to have access to health services. And then, fortification might still be needed because you still can't grow or afford the seed technologies, even if you have irrigation in place for a more nutritious diet. And we still need animal source foods, and you might irrigate, you have more income, but it might still just not be quite enough to purchase livestock products. But it's not an automatic. So I put irrigation system in, there is no guarantee that nutrition is improved. And that's why you talk to some people and they say, no, irrigation is not good for nutrition. That's why I heard those opinions, and now we know why, but we know we can change it. So for example, WASH is definitely an important story. So the WASH crowd don't like irrigators for a reason, and so we can do something about it. And then of course, we really have to be intentional and bring women into the story. And most irrigation engineers, most are still engineers, which is not a bad thing, it's a good thing, but we need to bring other disciplines in, and we obviously need to engage women during the irrigation design and also the scheduling and the management, etc. And last but not least, I didn't focus on that part at all, but water scarcity is rapidly, obviously, increasing. And so we really need to improve the quality of irrigation. And I think the water scarcity alone, I think, is a reason of why we have to focus on nutrition more so than just growing more calories. But it also means that while producing better nutrition, the irrigation quality itself has to dramatically improve. And that is, of course, reducing pollution, using more crop per drop, but especially more vegetables and animal source foods per drop. So we have to bring it all together. And really it has to be a community effort across many different disciplines, and irrigation has to be part of a larger food security and nutrition continuum that also brings in other interventions. So with that, I'd like to close and thank everyone for listening to this talk, and I hope you can take at least one thing away from it. I'm not going to ask you now what that is, but hopefully once you leave the room, there's something you'll do differently. Anyone working on irrigation that supports nutrition. Thank you. Should I sit down? Yeah.
Well, thank you, Claudia. I really appreciate that. It was a beautiful presentation talking about some of the challenges that we face. And so with that, if you'll just hold our questions for Claudia until the end when we have our panel discussion, I really appreciate it, because we have two more panelists that are going to speak briefly about some of the work that they're doing and some of the engagement around this particular issue. And so with that, I want to introduce our panelists. Obviously, everybody has met Dr. Ringler and got to hear about some of the excellent work that she's doing. But then we have Dr. Abby Rakes. Dr. Abby Rakes is the director of the University of Nebraska Medical Center's Center for Global Health and Development. She's in the College of Public Health, where I am also located. And then we also have Brandon Honeycutt. Brandon Honeycutt is a fifth-generation Nebraska farmer and chairman of the Nebraska Corn Board, who's going to be talking about some of the work that they're doing as well. And so with that, I don't know if Abby, if you wanted to come up here, if you want to sit there, totally up to you all.
I had to confer with my fellow panelists.
Thank you so much.
Thank you. And it's really delightful to be here. As Jesse said, I'm one of his colleagues at the College of Public Health, and I also come from a farm family. I think came about the same time. At the end of the 19th century, my family farms in Saunders County. So it's really great to have this opportunity to talk with you. So you may not have come to this conference thinking that you would be hearing from a child development specialist, but I am in fact a developmental psychologist. I spend my time focused on early child development. I have projects both in the United States and in lots of countries around the world. So I'm going to talk a little bit about some of the themes that Dr. Ringler mentioned, particularly around the ways that we think about child development and human capacity building as we're thinking about water and agriculture and nutrition. So I had a picture. I don't think it's up. Oh, there it is. Okay, great. Thank you. So this picture comes from a project that we conducted in Western Rwanda. This is an area called Karongi. And we just so happened to be coming by as children were playing in this water. And then the person, one of my colleagues from IANR, who was one of the researchers, said, oh yeah, this is where all of the water comes from. So they were playing in it. People were using it to take back to their homes for all of the different cooking and cleaning purposes. So that water looks brown, right? Like that does not look like clean water. And in fact, the work that we did revealed it was not, in fact, anywhere close to being clean water. Rwanda, despite progress in many areas, still has a stunting rate that's closer to 35 to 40%. And we know, as Dr. Ringler said, that stunting that is associated with a lot of negative outcomes. I do want to take one factoid from my world and global education. The learning poverty rate, which is the number of children who cannot read after 3 years of formal schooling. So these are kids who are 9 and 10 years old and going to school full-time for at least 3 years. In many parts of sub-Saharan Africa now, it's at 90%. 9 out of 10 children. So you've got both the situation of stunting, in some places it is declining, coupled with very poorly functioning education systems, and you put that together, and what you have is a tremendous challenge for global capacity building. I think that my call as someone who spends time on child development is that we shift the frame from focusing on stunting, one very important indicator, to holistic child development that really sets up societies for long-term success. So the inputs to stunting that were mentioned are all ones that I really want to highlight, and I want to thank Dr. Ringler for putting one of them on the table in particular, which is the access to stimulating and supportive home environments. That is one of the most critical pieces for early child development. Children can experience stunting. It takes a long time to address stunting. And with the type of stimulating and supportive care, can actually gain quite a bit in terms of cognitive outcomes. So when we're thinking about these patterns and of how we want to set up people to really care for their children, because boy, I tell you, everybody loves their children. Everybody wants what's best for them. And so really what we want to do is set people up to be able to make that happen for their children. And the time allocation for parents to be able to invest in their children has to be part of the solution. So particularly around women, also engaging fathers, as Dr. Ringler mentioned, and then really shifting our focus to say, how do we put this together in ways that free up the time for people to invest in their children at the same time that we're increasing the nutritional quality for kids. I do want to make one quick comment about Nebraska. In addition to the work that I do globally, as I said, we do a statewide survey in Nebraska called the KidSite Survey. We survey parents of children birth to age 5 across the whole state, weighted to be as representative as possible. We found in 2023 that nearly half, 50% of Nebraska families were reporting some degree of food insecurity. So these are children who don't necessarily show up at the doctor's office as having a nutritional deficit that is on the growth charts. Maybe some of them do, but a lot of them don't. And we then see huge associations between parents' reports of food insecurity and child development outcomes. So these issues are ones that we have too, and that we need to then figure out how we're going to put together all of these different sectors and ideas to come up with solutions that really work well for this state. Drawing on some of the amazing innovations that come from other countries. We can really learn a lot from looking at other countries. So my last point then is really around the challenge of the research to execute, to find good solutions. It's really hard. And it's great to see so many people here who are interested in taking on that challenge. I will say, of all of the early childhood meetings that I've been to throughout my career, and that's really a lot, I don't know that I've ever seen the agricultural community represented. And it's probably true the other way around. I think it's just often quite difficult to bring people together in ways that lead to solutions for kids and families. So thank you so much for your attention, and I'll turn it back to you, Jesse.
All right. Well, thank you so much, Abby. Great job. And so now we'll welcome Brandon to come up and talk about some of the stuff that he's been working on and engaging around. So thank you so much, Brandon.
Thanks, Jesse. Well, thank you, Jesse. Good afternoon, everybody. As he mentioned, my name's Brandon Honeycutt. I'm a farmer from Geltner, Nebraska, where I farm with my dad and my brother. And being part of the Heuermann lecture is of special significance to me because Geltner, Nebraska happens to be in Hamilton County, which is also where Keith is from. So I spent a lot of time growing up driving by the Prairie Valley hybrids, by the popcorn fields, and just being able to see what was going on. So I'm really appreciative to the dedication he showed to agriculture, the University of Nebraska, and specifically Hamilton County. So thank you very much for that. So we're known as Honeycutt Farms, and a little bit of what I just want to show up here on a couple slides is what goes on. We have obviously a center pivot going on there, and just in the lower right-hand corner, you see where we've evolved from center pivots into being able to monitor everything and run everything from smartphones, from the computer. When I came back 25 years ago to the farm, we did not have those capabilities. We still had some fields that had flood irrigation, having to go out there and change pipe, change gates. Those that are farmers in the room know how much fun that was and how much easier it is now to where we're at with center pivots and being able to monitor things from the phone. And that's just a little look at the farm, just kind of what we're doing when it comes to conservation practices, and that plays a key role into irrigation. You know, on the right-hand side, you see a cover crop with corn growing in it. The middle picture is what I was actually doing this morning before I came here. I was strip tilling, trying to get the fields prepped, just in a 10-inch swath of ground, getting that ready to plant. And then just a little picture of our bin site where we go at the end. But when it comes to irrigation and water practices, for me personally, it started about 15 years ago working with the University of Nebraska. We started putting watermark sensors in because there was trying to figure out what we were doing when it came to irrigation. I'd done 1 year of agronomy work with Servitech, and so we had what we called the handfield method, which was put a probe in the ground, pull out a soil core, and then you'd feel it and say, okay, it feels like it's at 70. Well, Jesse and I could have different, what that number was. Was that 70? Was that 80? Was that 40? It's like, okay, this is, I will admit, it's dumb. It's archaic, and I apologize to any agronomists in the room still doing it, but it is archaic. There are better methods out there. We started with watermark sensors, and that was better because it gave us a moment in time, but only 3 static points of where we can measure soil moisture. Fast forward, we kept adding different sensors to the point now that we have 2 different sensors we're running in the field. One is permanently installed, so I can go down 48 inches any time of the year, see what that moisture content is. The other one is a ground penetrating radar that sits on that center pivot, and as it's making its circle, it's pulling data points, 200 data points instead of 1 static data point. So this plays in the role of irrigation for us to understand how much water we need to put on at any given time. What this has led to is being involved with different activities of what is going on when it comes to irrigation, what's going on when it comes to the things that happen in Hamilton County when it comes to maybe some childhood cancer rates. And also currently I sit on the water task force with Governor Pillen that he put together just recently, as we're looking at how do we measure water quality and water quantity, and what are the future tools we can use to make sure that we keep this resource here. And we do not overuse it like has been done in some areas of the United States, because we realize how important having water in Nebraska is to growing a crop. Just for this year alone, the projection looks like we're going to be in a severe drought. One of my fellow farmers in the room sent the map out this morning of what June, July, August, September are going to look like. Without irrigation, we would not raise a crop. But without proper irrigation, we will over-irrigate that crop, and that causes a whole host of problems when it comes to running nutrients down into the groundwater, which then leads to a whole another level of problems, or running those nutrients or those crop protection products off of the fields into the water streams, and then that comes into Lincoln, it goes into Kansas City, eventually into the Gulf, which leads to obviously other problems. So there's a lot of work that we've started doing personally on our farm to figure out how we can better mitigate our risk, and it's spreading throughout Nebraska. Panel right before this, one of the fellow farmers on there, he's really on the cutting edge of doing stuff, but he's the one that other farmers are looking to. And as there's been this adoption of this technology, it slowly gains steam. So I can drive around most of the fields in my area, and I'll see some orange flags sticking up after planting, and I know exactly what that means. That means somebody has a water probe out there to measure soil moisture to see how much water we're utilizing. So it's become sort of a passion of mine to be able to work with the University of Nebraska and others to say, how can we best manage this resource going forward? And we do it on our farm to the best of our ability. Do we do it perfect? No, but in years like this, I think it's going to become vitally important. Thank you.
And so that kind of wraps up our presentations, and it'll open up into our opportunity to speak and engage with the panelists. And so if anybody has questions for our panelists, we can jump into that. And I will kick it off because I actually have quite a few questions. You know, it was great to hear all of you talk and the different perspectives that you all provide. Everywhere from some of the challenges that we face, some of the potential implications, and how we can address these complex issues on the ground. Now, one of the things I'm really interested in, and you've all talked about it a little bit, but how can we build better partnerships? And who are the partners that need to be at the table? And like I said, some of you already talked about that. And do you have case studies of where this has gone well? Or things that maybe we can try to build around or use as an example to try to move forward in some of these areas?
Guess I'll go. I think a lot of it comes down to, and specifically in our area, working with farmers, local municipalities, trying to make sure that we're working together since we have the same, in a lot of ways, we live in the community that we're growing the crop in. So whether it's a small town or whether it's a bigger town, making sure that we're talking to each other and working with each other. And at the same time, in Nebraska, we have the 23 NRDs, making sure that we're all on the same page, that when it comes to natural resources, how are we utilizing them? How are the farmers working together? And without having the heavy hand of the big government come in and really dictate what's going on. But I think that there's a little bit of that, that public interaction.
I think I've seen it work well with shared goals. So if there's a sort of a shared mission around, like Rwanda, for example, has an integrated early childhood policy that is one of the most innovative in the world, really, because they have a goal around healthy child development. So the nutrition people, the healthcare system, the education, the parenting support people all come together to come up with strategies. So I do think that type, and that's a government policy, so that did come from government. I also want to mention, though, in Nebraska, that Communities for Kids, it's a childcare focus, but they've done an amazing job of convening stakeholders in Nebraska communities around some of the same issues. So I think some of it is just setting the table to say, yeah, we do want all of the sectors here. Reminding everyone that you have to be really patient, and it can take some time to work out where those points of connection are, but I do think that can be an effective way to move forward.
Yeah, and then, I did already mention that, for example, in Tanzania, the community health department, unfortunately, that gentleman retired. I don't know if his successor is still doing it, but he's like, yes, we need irrigation, and I'm sending my health people to take irrigation classes. So that is a very, very good, a very positive one. And I think the Ethiopian, Public Health Institute has also come around a little bit towards the benefits of irrigation for nutrition and health. So I think they're not quite as negative about it. And the one other example is, governments are obviously not yet doing it, but they certainly could bring, the agencies could bring the agriculture extension and rural community health workers together. So the community health workers are out there in most low-income countries, and often super successful, have made dramatic changes towards birth outcomes and things like that. And bringing them together, they are overburdened, so we can't ask them to take care of irrigation, but at least chat, talk with some of the extension services. Extension services, unfortunately, generally don't themselves not very much aware of irrigation yet. Focus on more on seeds and agronomic practices, and not really on irrigation. That's also a problem. But to the extent that they can and do, have them talk together, same thing, what are our shared goals? And the shared goals at the end is still healthy families, generating some profit, and obviously having enough food on the table. So those goals are, they're not different from the two. And then to see what are the 2-3 things they can bring in from the nutrition side. You're irrigating, so those are the additional crops you could consider, or even some irrigated fodder, and bring in some animals. And the same on the extension side, to say the way you're irrigating, you might be attracting malaria. You might be attracting some diseases. That you can actually, you don't have to. You just have to change the way you manage your system. So if they both go a little bit outside of their comfort zone and actually talk to each other, I think we could really get better outcomes.
Nice. No, I think about that all the time. With work that I do, a lot of times we don't see public health at the table, drought-related work, and that's obviously a concern, and then also around the water quality issues that we've addressed as well. And it's interesting, Abby, with some of the issues that you were talking about, how you haven't seen agriculture, potentially vice versa as well. And so there is definitely a lot of opportunity for building some of these partnerships. But there's also opportunities to incentivize as well. I think about some of the nutritional challenges that some of you have mentioned, and that there's nutritional challenges even here in Nebraska. We're in the middle of an agricultural state. There's a lot of crop production here, but then you're seeing that across the globe as well. What are ways that we could be better incentivizing farmers to help with addressing some of these nutritional needs? And that one I'll just kind of open up, and I'd be fascinated because you have 3 different perspectives at 3 different scales that you've all worked at.
There might be more perspectives in the room. So, yeah.
Well, I guess I'll jump in on that one. So I think that's a great question. And I think that I'm eager to hear what you have to say, Dr. Ringler, about this. My perception of many of the countries that I've worked in is that it's a constant battle between how much food you keep versus what you sell, so that there's not a lot of wiggle room there to try to, and that you're gauging what your family can get by on versus what you can make at the market. So I think that the education, though, that I've seen of this is what you should be feeding your kids, that some of those types of things actually can be really important for shifting the incentive systems of just helping people understand. Again, probably sounds like a cliche, but people all over the world care deeply about their little children. And sometimes I feel like that emotional component is one of the biggest incentives out there. People want to do the right thing. And if they're not doing the right thing, it's because there's a barrier in the way. In Nebraska, I think that we're just trying to understand more about what that food insecurity looks like for people with kids under age 6 was the population that we were looking at. So, and my brother's a farmer, and I think that that's probably also a lack of communication and a supply chain issue. I mean, to be honest, if I went to my brother, if I called him and I was like, "Hey, Justin, I need you to start growing vegetables for people in Ashland," I don't know what he'd be like, "What?" I think that's what he would say. So I think that there's still some degree of maybe some innovative ways of trying to figure out how to bring those 2 pieces together.
Yeah, the Nebraska piece is interesting because I was just wrapping my head around that one. We've tried greenhouses, but hail kind of destroys those. That doesn't work so well. But as it's going to take a wider effort. That is there something that we can on a pivot corner? Since that's a dry land area, but we can still find a way to water it. Is there something else we can grow there in a way that would maybe help with that? But we're corn and soybeans and beef, so I'm not sure how we switch from that very, very easily. Without a big concentrated effort or vertical integrated farming.
Yeah, so maybe, there's so many potential answers and so many aspects. So I've just 1 or 2 things. Even 30 years ago, I gave a talk on food prices, and 30 years ago, what we can call rice pudding is the most subsidized commodities. And not the most, the milk is very important now for the children, fine. But it's sugar, rice, and dairy. Those are the most heavily subsidized commodities. 30 years ago, I'm pretty sure still, I didn't look into this recently. So as long as, some commodities get heavily over-subsidized, or they get the bulk of the subsidies, that means the incentives to go into other commodities is limited. And if you then have additional incentives, to not grow food, but, you grow biofuels, of course, if that incentive is out there, why would you even think about coming up with a new way to build a greenhouse that doesn't get destroyed by hail? There's no reason to do so because you have enough other reasons to just grow what you do. But so the big so that's one thing, that some subsidies might be misplaced if you're serious about nutrition. The other one is still the relative price. So, and of course, even CGR is, being accused, or you're putting all of your public ag research support goes to basic staples. And from the beginning, wheat, rice, maize. Maize is now mostly private, but a few other crops, sorghum, cassava, but not necessarily the most nutritious crops. But the reason is that whenever there's a food price crisis, and they come, all the time and faster, and that's why we also have high food insecurity, even in Nebraska and Canada too, where I'm based, So whenever we have that crisis, then the poorest people, they will go to the cheapest foods, and those are the cereals, the staples. And if we would stop investing in those, then they would have nothing to go to. So the price difference between vegetables, fruits, and animal source foods and the basic cereals is still very big because we have invested so much and we're subsidizing. But we've also invested a lot in ag research for those commodities. But if we would stop doing that, and we have the next food price crisis that for sure will come, and we're still in one to some extent, then they have nothing to go to. So we need to do both. We need to keep investing in those to keep the prices affordable, or we give money to those who can't afford, to those food insecure households, SNAP programs or whatever. We need to directly support them so they can afford more expensive foods, or we have to get the food prices down. And right now, the affordability for some of those vegetables and animal source food is just not there, which is why we are getting to these to the 3 billion people who cannot afford a really healthy diet. But as you also said, then the education piece is essential. So we have a lot of nutritionists, and and they have been trying to get support to keep doing this social and behavioral change communication to change dietary habits and nutrition. And then the donors are saying, we funded it once, we're not funding it again. But it is like a seatbelt. You go on the plane, and every time they tell you, you have to put your seatbelt. Next time you go on a plane, they tell you again. For the nutrition education, you actually have to do it every time again. It's not something you learn it once and you will do it. You actually have to remind people every time. If don't follow, getting this more balanced diet, you will really, you live fewer years, you'll be sicker more often, etc. Unfortunately, I wish a single time, single intervention on what constitutes a healthy diet and how you can access it is enough, but it's not. And that's just our human, as we are as humans. We unfortunately have to be told many times. Yeah. So we need to do something about that.
Yeah. No, and if anybody has questions, don't hesitate to go to the microphone or raise your hand, and we can even potentially have somebody run over with the microphone. That's my favorite part of this session. And so, do we have somebody going to the microphone? Yes.
Yeah, I feel like, correct me if I'm wrong, but I feel like you're all kind of talking around the issue of food waste, because I have read that there's a lot of food that is wasted at the pre-consumer stage in developing countries and at the post-consumer stage in developed countries. And also all of these staple crops that tend to be the ones that are irrigated also are shelf stable, either in themselves or in the products that they tend to get turned into. So I'm wondering if you see other opportunities in the supply chain, not necessarily making it all the responsibility of farmers, or, sorry, out of breath, or maternal nonsense. So all of the responsibility going to farmers or families, consumers, but if there are other parts of the supply chain that you see opportunities in to bring in partnerships to solve some of these problems.
Sure. I mean, yes. Actually, none of us planned to talk about food waste, and no one did. But if you take a food systems approach and you want to conserve irrigation water, obviously cutting down on food waste and loss is a very, very important intervention. It also can be a very costly intervention. So, right, Again, in sub-Saharan Africa, I think only between 30 and 40% of the rural population has access to electricity. So that's of course, part of the reason why, they can't open a fridge and find some vegetables or fruits. They'll have to go on the market, and the vegetables will not last because there is no way to really preserve it because there's no electricity, there's no cold storage. So those are all interventions to get down. So energy interventions are also very important, not just irrigation. And also you kind of need energy, obviously, for irrigation. So there's a lot happening now with solar irrigation to provide energy to deploy irrigation, but you can use solar or decentralized rural energy systems, or finally get electricity access to preserve milk, but also fruits and vegetables to some extent, to reduce on food loss and waste, because food loss and waste is by far the largest for the non-staple commodities. So exactly the same ones where people don't have enough access to. So there's a lot of that loss, as you said, happening before the consumption stage in low and middle income countries, and much higher loss or wastage, that's the term then, happening at the consumer stage in high income countries. But of course, this is, there are always exceptions to all of the rules. And again, there's countless interventions are happening to try to address that. At the margin, it's very difficult to completely avoid it. Again, for many reasons, and in fact, those droughts and floods, floods are obstructing traffic, and even the COVID-19 crisis, a lot of food chains and systems, transportation systems were interrupted, and all of these inefficiencies, often human cost, obviously, are generally human cost, contribute also to food waste and loss.
Any additional questions from the crowd? And so I think we're getting close to the end of our time. And with that being the case, it's easy to focus on a lot of the negative because there is a lot of things and challenges. And that's why we're here, is to address challenges. But there's always that opportunity to think of the positive as well. And, as we were kind of discussing, one of the things I was thinking of like local food systems and trying to improve food access. I remember hearing about the Winnebago tribe, which is here in Nebraska, and during the flooding event that occurred in 2019, after that they invested, and if there's somebody from the Winnebago tribe, you're probably going to do a much more beautiful job of saying this than me. But they talked about how there was a lack of food availability because of the flooding situation. And then that spurred them to create a community garden, and that helped with education, but also food access within that community as well. And so there are opportunities for these positive things to occur. And so with that, just kind of that challenge or that throwing that out there, what are some opportunities or what are some of these positive things that you're excited about or want to share with the crowd before we wrap it up for today?
I can throw out one. I am excited at the innovations at community levels, like of the local communities that are stepping up to try to figure out what to do. Like the Winnebago is a great example, and I know that there are lots of other Nebraska communities, and then we also heard of solutions when I travel to other countries like Rwanda. So I think that small groups of people who are really dedicated to improving the lives of their neighbors and friends and their own families, that always makes me feel hopeful.
I think from my standpoint, especially when it comes to irrigation, just seeing what the irrigation companies are doing, especially the pivot companies on the research of the technology that's coming forward, not just for myself as a corn farmer in Nebraska, but as we can spread that technology throughout the world, as we try to increase irrigation in sub-Saharan Africa. It's not going to be the same as it is in Nebraska, but what can that technology bring, plus the technology we're already using on the farm, and then as well as what is the next generation when it comes to AI and predictive analysis? How can that help farmers and people in other countries as well?
Yeah, I mean, I don't think I can add anything as great, but I mean, I mentioned 1990 stunting levels were 40%, and today they're 22%. So, you know, it's not that we have achieved nothing. So I think we have come quite far. We are still somewhere where we absolutely morally and ethically should not be. There should be zero stunting. But we have come quite far, and I think we have increased the toolbox and you know, the options that are available to address nutrition. Yeah, the toolbox is so much broader and wider, and small-scale irrigation that really only has taken off, you know, to the extent that's useful. That means mechanized small-scale irrigation. You know, in the late 70s, 80s, it really just started. And in sub-Saharan Africa, it's really still just starting. And so there's a lot of opportunity for improvement. Of course, a lot of risks also involved, but the chance, at least, of better water management and more water security to make a difference for nutrition, livelihoods, incomes, is much greater than it was ever before. And so, again, part of it are those, you know, technologies that came in, such affordable well-drained technology, and in fact, those individual motorized pumps. But again, on their own, they're not necessarily, you know, they have challenges, but improvements are happening as well. So in the small-scale irrigation space. And so maybe we can also bring more of those larger technologies in and see how, you know, how those can be used in more smallholder settings. And so, yeah, I definitely, despite, you know, the trends that we're currently seeing, there's still a lot of reason for hope. And let's just see how those trends continue. Like, you know, if we look back in 10 years, have we improved, or do we continue to stagnate or go in the wrong direction? So let's hope that we certainly have the tools and we have the means. We just really have to get going. Yeah, thanks.
Well, thank you so much. I really appreciate that. I think this was a wonderful conversation to kind of bring together and show the diversity of people that we need at the table. And so with that, I just want to thank all of our panelists for being here today and participating. We look forward to the discussions that hopefully this brings about over the next few days and hopefully for years to come, so that we can address some of these major challenges and have Water for Food be a leader in this realm as well. And then, so I'll just quickly want to thank our panelists.